Hi guys, so we're back. I just want to quickly go over what I would typically do with a patient. Hi. So we've already met, we've already signed the consent. So remember, we don't start procedures until we sign consents. Vital signs have been taken, initial vital signs by my assistant. And then I've already done a physical exam on her, and we've kind of already chatted as far as any history. So she is a healthy, otherwise normal state of her health young lady. And I just wanted to bring this with me to show you guys. So typically, while the patient's waiting in the waiting room, they have access to the booklets that they could kind of see which IVs we use. If they wanted to discuss a little bit further, there is a nutrition guide that we can kind of really go through if she had any particular complaints, whether it ranged from fatigue to anxiety, to dehydration, depression, diabetes. The list goes on. This is a nice kind of supplement to aid in you, choosing the right IV nutrition for your patient. All right, so we have decided what we're going to do for her. This is what the kit for Liquivita looks like, and this is the company that I use. The reason that I really like working with Liquivita is that they supply basically everything that you need in a box. So when we open this up, we're going to notice that it comes with the ingredients that we're going to be using. It comes with my IV catheter. It comes with everything to clean and secure the IV. It comes with the IV fluids, exactly what you need. They give me a large syringe so that I can draw the ingredients and put it into the IV. And then it comes with the tubing that I'm going to be needing. The only additional things that I like to use, and again, this is just extra added safety. I use an IV connector as well as a flush because I want to make sure that I'm in the vessel. I have Band-Aids here. I have 2x2s. I told you guys that I like to do alcohol and Hibiclens. I always have extra tape just so that I can make sure that I don't run out of tape if I need to secure the IV. And then I actually like to work with 10cc syringes. I just find that it's a little bit easier as far as me handling it with one hand to be able to draw the items. So one of the first things that I like to do, which I already did, was ask her if she was left-handed or right-handed. So we are going to go on her right side. And while I'm getting everything ready, I always like to apply my tourniquet so that, again, I can start having that vessel kind of pop for me and just become extra obvious. So I want to make it tight, but I want to make sure that she's comfortable. You're okay?
Yes.
Perfect. Okay, if I didn't mention, the kit actually comes with gloves as well. It's just that I like my black gloves. All right, so Christina's gonna be coming in the room. She's gonna be assisting me because you always have to be ready for any kind of emergencies or any little unexpected things. All right, so here's some alcohol. Guys want to make sure that you clean that area well. Make sure that tourniquet is out of the way for you. All right, I always like to have a little extra 2x2 ready in case anything kind of bleeds, that I don't make a big mess. Okay, so I'm going to get my catheter ready, and then I usually give my assistant the IV connector so that she's ready to pass that on to me. And I also have my flush ready. And then I keep nearby my Tegaderm and my extra tape that I like to use. So here you go, Christina. All right, so this is a 20 gauge. That's what comes with your kit. Always make sure that you kind of know how the catheter works, because every mechanism is slightly different. So the last thing you want to do is find the vein and then you're not sure which way you have to push. All right, so have the patient make a fist, and that usually helps you to kind of find the vessel. You doing okay? All right. Perfect. So I mentioned earlier, I like to try to go into the antecubital area whenever possible. She seems to have a nice little vessel in this area that I can palpate. I like to make sure that I stabilize so that it doesn't roll. And then I'm going to simply go into the vessel and start my IV. So tiny little poke. Okay, I see my flash. I go in a little bit further just to make sure we're in. Okay, I let go of the tourniquet. I have this ready here, and then Christina's going to give me the IV connector. You're going to remove that, and you're just going to pop it in here for me so that we don't make a mess. Good. Got that. Got it. I got it. So make sure that you put your sharps away so that needle has a retractor. Make sure that you don't move this around too much. And then she's going to hand me the Tegaderm so I can secure this IV first. Christine, I'm going to need you to hold right there for me. Just stabilize that. Got it? Okay. Okay. And then if you cut me a short piece of tape and then uncap that for me, and I'll take that. Well, you're cutting me a little tape that you're going to place right here. So I like to secure the IV with the Tegaderm, and then I like to do an additional piece of tape right here, so in case that Tegaderm moves, that it's still secured a little bit lower there. Right there, perfect. Beautiful. Okay, so now I want to make sure that this is flushing properly. So I'm going to push back, and you see that nice blood flow, and then I'm pushing in the flush, and I'm looking at that site. So I want to make sure that there is no accumulation of fluid in that area. So that's perfect. Everything feels okay? Yeah. No burning? Beautiful. All right, so our IV's in place. I'm going to go ahead and close that off, and then she can relax for a moment. So be comfortable. And then I'm going to now build my IV. So the first thing I do is hang this guy up here. Open that for me, the IV connector. So you want gravity in your favor, so you want to hang it high. We always have blankets available for the patients. Typically they're in a room where they have access to a TV, or they can play on their phone. All right, so the next important thing is that you're going to flush this line. Remember, we talked about air embolisms, so we are going to not have that be an issue. So we are going to open this up, insert our catheter, and this is going to start running, and we're going to watch it come out all the way. So make sure you're by a sink or by an area that you can throw away, and you're watching all those little bubbles come out. Perfect. And then I bend it so that it stops, and now I'm going to connect it to the patient. Okay, so now we're connected. Good. This is that valve that I was telling you about. So you can control the rate through here, or you can control the rate through there, okay? I typically give it a little pump so that I can really see everything that is gonna be infusing. So I'm gonna close all that off. So everything is now connected, everything's nice and flush. And now I'm going to start adding my vitamin C and whatever nutrients and minerals that I picked. I told you guys that I like the 10 cc syringes just because it gives me a little bit less pressure on my hand. So everything is single dose, sterile, so I'm popping that off. I'm trying to minimize any touch that I have with the circuit. So I did not touch the top of that. I'm not touching the syringe. Pump a little bit of air, so I pull back on the syringe, and that just facilitates the drawback of the medication. It may take more than one syringe full to get everything that's out of the bag, but remember that's what's in the bag, so that's what you're going to be infusing. And this is... All right, so another little trick is when you use this 18 gauge, remember this is very sharp. So you want to make sure that you enter that IV bag totally in the center of it, because if you go at an angle, there's a chance that you can pierce that bag and you're going to start leaking. So these are little tricks of the trade that unfortunately you learn with trial and error. All right, so I like to mix everything before I start the IV on the patient. Okay. All right, so I'm going to close this back up. All right, and now we're going to open the site over here, and then you notice that my flow is very fast, so I'm going to slow it down. Initially, I want her to start feeling what the infusion is going to feel like, so I'm going to go very slow. You see that it's only a few drops a second, and everything is flowing through the system. Feeling okay? And I'm watching this site in particular. Okay, I'm watching for any abnormalities in the tissue, any swelling, to make sure that my IV is in the right place. I'm asking how the patient is feeling, any signs of nausea, any signs of weakness. And then basically, as soon as I let this run for about 5 minutes at this rate, I just slowly start to increase the rate. And this is going to run for about an hour. Like, that is standard in my practice. Slow will get you always safe, so that you don't have any issues.